When you think about modern medicine, what's the first thing that pops into your head? Probably high-tech scanners, lasers, really advanced surgical tools, right? But what if I told you that the single most important instrument in any doctor's toolkit is something, well, way more fundamental? So, what is it? What's the most powerful diagnostic tool out there? Is it a super high-resolution MRI, a complex lab test, maybe the latest and greatest piece of medical tech? Well, the answer might actually surprise you because it's not a machine at all. Yep, it's the patient's story. Honestly, you should think of a diagnosis almost like a detective case. The most crucial clues, they aren't found in a test tube. They're hidden deep inside the narrative of the person who's asking for help. So how do you actually uncover that story effectively? Let's break it down. Okay, so the first and most critical phase is just gathering all that information. And look, this isn't about running through some checklist of questions. It's really an art form that relies on very specific techniques to draw out the full picture. There are 3 core skills that make this whole thing possible: listening with real intent, asking the right kind of questions, and then, you guessed it, summarizing everything to make sure you're on the same page. Let's unpack each one of these. First up is active listening. Now, this goes so far beyond just hearing the words someone is saying. It's really about paying close attention to how they're saying it. Their tone of voice, a little moment of hesitation, their body language. That's where the gold is. Psychologically, this is where a patient feels truly seen, and that feeling of safety, that's what allows the really critical details to finally come out. This really means creating the space for the story to just unfold naturally. It means resisting that powerful urge we all have to interrupt, because when a patient can speak freely, they often reveal these connections and details they might not have even realized were important, just because they feel safe enough to explore their own thoughts out loud. And this leads us right into the next tool: open-ended questions. Just look at the difference here. Does it hurt? Well, that gets you a simple yes or no, a dead end. But asking, can you describe the pain? Now, that's an invitation. It opens the door for the patient to share the actual character of their experience. Is it sharp? Is it dull? Is it throbbing? Those details are diagnostically priceless. And the final technique in this phase ties it all together beautifully: summarization. So after listening carefully and asking those great open-ended questions, the provider repeats back the key details in their own words. Something just like this. This simple step does 2 absolutely vital things. First, it's a critical fact check, right? It makes sure the information is accurate. But just as important, it's telling the patient, hey, I hear you, and what you're telling me matters. That simple confirmation builds this incredible foundation of trust that's not only essential for good care, but is in itself pretty therapeutic. Okay, so you've gathered all these clues. Now what? Well, the next step is to organize them into a story that actually makes sense. A jumble of facts isn't very helpful, is it? You need a timeline. And why chronological? Well, because medicine is all about cause and effect unfolding over time. This structure helps a doctor spot patterns, understand how an illness is progressing, and see which past treatments have worked, or, just as importantly, which ones haven't. This is pretty much the standard framework. You start with what's happening right now, the main reason they came in. Then you start moving backward in time, layering in past medical issues, any previous surgeries, and finally, you get that broader context of family history. Each layer adds more depth and a ton more clarity to the current picture. So we've talked about how to gather the story and how to organize it, but let's just zoom out for a second. Why is mastering this seemingly simple process so incredibly important? What's the big deal? Well, here's the payoff. When a healthcare provider truly masters the art of the patient's story, everything else just starts to fall into place. It leads directly to more accurate histories, which then fuel better diagnostic decisions and ultimately lead to better patient outcomes. It all starts with the simple, powerful act of listening. It leaves us with a really fascinating question to think about. As medical technology becomes more and more advanced, are these fundamental human skills going to become less important, or maybe even more so? Perhaps the greatest innovation in medicine won't be a new machine at all, but a renewed focus on the story.